name's Elliot Sharples Gordon. I'm the third generation of the Medicare family.
My son.
And I heard that Medicare.gov is going away. And I know that a lot of people use that to search for their prescriptions and also Medicare Advantage plans. So is that a good thing or is that a bad thing? I'm gonna have a seat.
Okay, Elliot, it is a good thing and a bad thing. The bad thing is the timing that the government is trying to roll it out on Labor Day of 2019, right before AEP. Not the best idea on the timing. It is potentially a good thing because they're going to add on their Medicare supplement plans. So you'll be able to compare Medicare supplement plans, Medicare Advantage, and Part D. And it's going to allow us to compare supplemental benefits on Medicare Advantage, which is a huge new world of benefits, and it's very competitive. Supplemental benefits are things you might have been familiar with already: gym memberships, transportation, meals, limited dental, vision, hearing aids. But now for 2020, it's a whole brand new world of supplemental benefits, such as pest control, dog food if you have a service animal, meals after you're discharged from an inpatient stay, massage if you have chronic pain, chiropractor, acupuncture, and many, many, many more. So being able to compare the supplemental benefits might be the whole ball game when the plans are very similar in other regards. So Medicare.gov is a site you may or may not be familiar with, and I'm going to pull it up here on the screen right now. Okay, here is Medicare.gov. If you haven't gone there, you can go there and play around with it. And you'll see on here, it'll say Find Health and Drug Plans. Get started with Medicare. You can go in here, take an early look at our new plan finder, try it now, create an account, blah, blah, blah. What I want to draw your attention to is the one thing that is actually replacing is the improvement for Medicare.gov. And it's where the government is trying to push all the 60 million people that are on Medicare. And that is the Medicare blue button, which, as you can see, in true government form, is nowhere to be found. So if you go to Manage Your Health, Medicare blue button 2.0, boom. So not easy to find. That's the government for you. Medicare blue button, what is it? How is it used? How will it help you? And this will explain this to you. And the bottom line is Medicare blue button, the government has all your information. The government pays your claims if you're on Medicare Part A and B. And so the government already knows, and it's going to allow you to have access to 36 months of your claims data, which is fantastic. For you to see exactly how you are using your Medicare, what the insurance company pays, what the government pays, and this is a step in the right direction. Now the problem is that less than 5% of people know this exists, and it's not new, it's like 8 years old. But now the government's trying to push us over there to use it, and it's probably a little premature, but we're gonna get there, okay? You'll probably need an agent to help you get it set up and to figure out how to use it, because most of my clients are not comfortable with this level of technology and they don't want to get comfortable. That's what agents are for. The problem is when you give this information to your agent, now your agent can see all your claims, and that might be a privacy issue. So you might want your agent to help you set it up, teach you how to use it and get in there, and then show you how to change your password so that your agent doesn't have that information. Or you might completely trust your agent and want your agent to have access to that information. So that's called Medicare's blue button. Go up to their main toolbar here. You won't find it. Hit Manage Your Health, and then you'll see on the drop-down blue button, and then you go in and you sign up. Now, the Medicare.gov plan finder, if you have used that in the past, used to save your information. So it had a list of all your drugs. That is going away. It won't save your information anymore. And this is coming over onto this site, the blue button. The blue button will do what Medicare.gov's plan finder could never do, because it will supposedly, because we haven't seen it yet, it will allow you to compare Medicare supplement plans as well as Med Advantage and Part D. It will allow you to compare those supplemental benefits, which, like I said, might be the deciding factor on what plan is best for you for 2020. So this is all brand new. Most of the agents in the country aren't aware of it. Clearly, most of the clients, the 60, 70 million people on Medicare, aren't aware of it. It's brand new. It's going to be a little bit rough, as the government rolls it out, if we have any indication from the past when the government rolled out Obamacare, the Affordable Care Act, and they came up with the Medicare.gov sites, which crashed and glitched and didn't save your information and got everybody really mad. So I'm not saying it's going to happen. But if it happens, don't get mad at your agent. Whether you're working with the Medicare family, don't yell at my family. We got it tough enough trying to deal with the government. Don't yell at your agent if you don't work with us. Just, understand that it's new and it's the government, and those two things add up to it's going to have some glitches, but we're moving in the right direction. You as a consumer, a Medicare beneficiary, will then have the ability to see your claims, to see your data, to access all of this information on your cell phone, on your tablet, and of course on your desktop. If you have questions about Medicare.gov's Plan Finder changes, about the new Medicare Blue button, scroll all the way down into the comments. Tell me what your comments are. We'll be happy to respond to you. If you want to call us, my whole family's sitting over there by the phone, and they'll be happy to answer your questions. It's always free to work with us. Give us a call if you're confused. We're here to help.